Hi, it's Carrie Butler with Action Utah, the policy director here. This week, our call to action you may have seen has been centered around interventions in public health interventions in areas that we have seen flare up or hotspots for the coronavirus and the pandemic. And so we want to talk about how we can best address the continued presence of this pandemic in the state. So we are really excited today to talk to Ciriac Alvarez, who is with Voices for Utah Children. She is a rock star public health expert. We are so fortunate to have her in our state and have her expertise in our state. And Ciriac, we're so thankful that you're willing to come and talk to us today. Now, you recently wrote a really great op-ed on something that we've been talking about in public health quite a bit, and that is community health workers. Do you mind talking a little bit to our viewers and to our membership about what a community health worker is and how you see that role playing out in our current crisis?
Yeah, thank you, Carrie, for having me on. It's so great to be here. And like Carrie said, I work at Voices for Utah Children. And one of the issues that I really care about is community health workers and how they work to address issues in our different communities. Community health workers are trusted members in our community who truly connect people to resources. They work in communities of color, low income communities, all of these different marginalized groups to make sure that families and people get the care that they need by being a culturally relevant person, someone that they can trust in their language. It's somebody that looks like them, that speaks like them, and can advocate for them. A lot of times when people might not necessarily have the skills or the confidence to do so themselves. So community health workers have always been such an integral part of our community. And I think especially now, it's so important that we uplift their work as the COVID-19 pandemic we have seen hotspots in our communities where more people are disproportionately affected by this pandemic. And we want to make sure that people not only get the testing they need, the treatment they need, but also the knowledge and empowerment and the support that they need as we go through this crisis. So thank you, Carrie.
And you mentioned that we've always had community health workers, right? Now, is that something that's a trained position? Is that something that's do they have to go to school? Is it a certified? Is it a paid position, or is that something that's just kind of or is it like a nebulous kind of idea?
So community health workers actually began from a grassroots perspective where people wanted to do more work and empower themselves, and they became promotoras, community health workers themselves, by getting connected to resources, by understanding what's happening in their communities, and really empowering themselves so that they can empower their own communities. And so as this system has grown, there has been more formalized education. There is a certificate program here in Utah. We are working towards a certification process so that community health workers are more recognized in the healthcare field specifically. So yes, there is a program that folks can take to become community health workers who just have like dynamic personalities, who can connect people to resources and things like that.
Okay.
But yeah, it did start off like as a community, like grassroots effort, and has really formalized. And community health workers in the past couple of years, especially, have done a lot more to uplift their work and to really come together and form like a CHW section and make sure that they are recognized for the important work that they're doing.
I think it's so crucial when we're talking about beefing up our workforce, that we're using or inviting in a workforce that is efficient and effective at what they're doing. And I think that's what you're saying, is community health workers are a little more effective at what they're doing because they're trusted resources within their communities, right?
Right.
That's great. So as we're talking about it, and as people are like calling their legislators and saying, here are some things that we would like to see to combat this pandemic, particularly in areas that are harder hit, particularly in low-income areas or communities of color, what's a funding mechanism for that? Is that something that the state typically pays for? Is that something that's Medicaid paid for? Like, how should we be advocating for funding this effort?
right now, Medicaid wouldn't be able to pay for community health workers, but that is something that we are working in the long term with the
Okay,
certification process for community health workers, then becoming a licensed like provider type, where they would be able to get Medicaid reimbursement. So in the long run, that is something that we want, just because it's
good.
sustainable funding from Medicaid. But for right now, I think with the COVID-19 pandemic, we're seeing a lot of different funding resources coming down to the state, right? From the emergency funds, from the CARES Act, from all of these different places that can be used for our like Utah Office of Health Disparities, that could be given to community-based organizations, that can be given to clinics, federally qualified health centers, where community health workers reside in all of these different places, or the community health workers section, which is the whole group of them. And that way they can distribute the funding. So there is a lot of different places that can use community health workers because they're so different in the work that they do. They can be resource connectors, they can help with contact tracing, they can get people connected to CHIP or Medicaid. There's so many different opportunities for community health workers to work, but there is funding, right, from the private and from the public sector and from emergency funds that can be leveraged and used for community health workers right now.
Okay, this is such helpful information, Ciriac. We're so thankful to you and your time. Is there anything else you want to add? Do you think that people need to know about community health workers, particularly as it applies to the pandemic?
Yeah, I think they're doing just really important work right now in getting communities of color and people who may not be connected to the healthcare system connected to the resources and programs that they need. And they're just such a vital part in our community. And I hope that we can continue to uplift their work and empower the work that they're already doing within their communities, because they really are driving health equity, especially during this pandemic.
Great. Okay, I'm a huge, huge fan. Thank you so much for all the work that you've been doing. And please let us know if there's anything else we can do to get the word out and get people calling their legislators and spreading the gospel of community health workers.
For sure. Thank you, Carrie, for having me on.